a detailed explanation of CSF culture, cerebrospinal fluid culture, covering all the aspects you've listed. 1. Introduction. Cerebrospinal fluid CSF culture is a critical diagnostic test in modern medicine, especially for identifying infections of the central nervous system, CNS. It is commonly used to detect bacterial, viral, or fungal pathogens, responsible for conditions such as meningitis, encephalitis, and brain abscesses. Definition: CSF culture is a laboratory test performed to detect and identify microorganisms, bacteria, viruses, or fungi in the cerebrospinal fluid. This fluid surrounds the brain and spinal cord and is obtained via lumbar puncture, spinal tap 3. Indications: CSF culture is indicated when a CNS infection is suspected. Common clinical indications include fever with headache, neck stiffness, seizures, altered mental status, sudden neurological symptoms, suspected meningitis or encephalitis, monitoring CNS infections during treatment. Used for: CSF culture is used for diagnosing bacterial, viral, or fungal meningitis, identifying the causative organism, determining antibiotic sensitivity of bacteria, monitoring response to treatment, distinguishing between different types of meningitis, e.g., bacterial versus viral. Number 5. Why do need of this test? This test is essential because CNS infections can be life-threatening and need prompt identification, helps in selecting the appropriate antimicrobial therapy, differentiates between infectious and non-infectious causes of neurological symptoms, determines if a patient with immunodeficiency has opportunistic infections. 6. What happens during the test? Preparation: the patient is asked to lie on their side or sit upright. Procedure: a lumbar puncture is performed to extract CSF from the lower back, usually between L3 and L4. Sample collection: the CSF is collected in sterile containers. Laboratory analysis: the sample is cultured on various media to promote the growth of potential pathogens. Additional tests, gram stain, antigen detection, PCR, may be done. Monitoring: patients are observed for complications such as headache or bleeding. Number 7. How long for my results? Preliminary results, 24 to 48 hours for bacterial identification. Final results, 3 to 7 days, includes organism identification and sensitivity testing. Viral and fungal cultures may take longer, up to 2-3 weeks. 8. Prepare for this test. No special preparation is usually needed. Inform your healthcare provider about medications, especially blood thinners, allergies, any bleeding disorders. Fasting is generally not required. Consent is obtained due to the invasive nature of lumbar puncture. 9. Risk 2. Post-lumbar puncture headache, bleeding at puncture site, infection at puncture site. Rare, brain herniation in patients with high intracranial pressure, back discomfort. 10. Interpretation of results. Positive CSF culture indicates the presence of a specific pathogen, confirms infection. Negative culture may still require clinical correlation. False negatives can occur, especially if antibiotics were given before the test. Other CSF parameters like glucose, protein, WBC count are also considered. 11. Normal values. CSF culture, no growth of organism sterile. CSF glucose, 50 to 80 milligram may vary. CSF protein, 15 to 45 milligram. WBC count, 0 to 5 cells per microliter, mostly lymphocytes. 12. Factors affecting results. Prior antibiotic use can lead to false negative cultures, contaminated sample, delay in transporting the sample to the lab, improper storage of the sample, technique of lumbar puncture. 13. Clinical significance. Confirms diagnosis of CNS infections like bacterial meningitis, e.g., Neisseria meningitidis, Streptococcus pneumonia, tubercular meningitis, viral infections, e.g., herpes simplex virus, fungal infections, e.g., Cryptococcus neoformans, helps tailor specific treatment and improves patient outcomes, aids in epidemiological tracking and infection control. 14. No more. Advanced techniques such as PCR, polymerase chain reaction, and CSF antigen testing may supplement CSF culture. Viral meningitis is often diagnosed with PCR rather than culture due to the slow growth of viruses. In immunocompromised patients, e.g. HIV, CSF culture is vital for detecting opportunistic pathogens. 15. Conclusion. CSF culture is a crucial diagnostic tool for identifying infections in the central nervous system. While it may carry some procedural risks, the benefits of early and accurate diagnosis far outweigh the drawbacks. Proper interpretation, in conjunction with other CSF analyses and clinical findings, is essential for optimal patient care and management. Thank you. Have a nice day.